No, I've heard it. I've literally heard people say it. They're like, when you're in the leg and stuff, they're like, you're really strong.
It's these little muscles right here. Make them work.
You're going to tell me if I have boogers, right?
Oh.
Yeah.
She'll tell you. It's kind of hard because you're like, oh God, this is going to go in front of everybody, you know? And it's like, well, it's not everybody. It's just a few 100,000 people.
Yeah.
When you really want to think about how many people saw it, you're kind of like, oh, can't sleep at night. Didn't you just want to have a simple practice? I thought that was the whole point of having a social media account. So I say it's better to just treat one person really, really well than to see 100 people and not have done anything for them.
Yeah.
I do a lot of this based on feel. I'm real touchy.
Okay.
I'm real hands-on here. I've almost got it in my mind here. It's like a 3D puzzle.
Yeah. That's so crazy.
I'm going to take it through a little bit of range of motion just to confirm what I'm thinking. And she's never had an adjustment before, but she's a self-cracker, self-adjuster. Then we're going to go over here, how about on this side. We don't want to walk around like this, so we compensate all the time to make the eyes level, or else we wouldn't be able to function correctly. Yeah. So we have all of these little variants all the way down the spine, and it's my job to find each one of those and try to undo them. It's called myofascial release.
As long as it's going to help me in the long term.
It will. You might not think it's so tomorrow morning when you wake up.
I'm going to be like, I'm dead.
I can't move.
What just happened?
But over the course of, the next 48 hours, you'll feel that. Or you might not feel anything tomorrow. You might feel like you can go run a marathon. I never know. I never know how people feel.
Everyone's different.
Everybody's different. Mm-hmm. Right here, C2 and C3. There's some swelling there. Right there. Nuts. Trigger points. Okay, so then I come into that joint right there. Yeah. And then
wiggle it.
Wiggle, wiggle, wiggle. You got it.
Joints like to be wiggled.
That's right. There we go. All right, here we go. Sorry. No, you're right. Baby adjustment. Very good.
That's what I'm like almost used to.
All right, well, we might get a deeper level in a second. Right here. Okay, go back the other way. I think that might be it for now, but we can try for a deeper level. Right here. Oh. And that was a deeper level.
That gave me chills.
And here we go. Nope, it's over here. Sorry. Nope. It keeps sliding out from under me. I don't want it to... Yep. Right here. Proprioception. Above, down, inside, out. Okay, good. Okay, here we go. Ankles. No problems in the ankles, right?
Right.
Reach overhead and grab the table. There you go. That's it. Pull back. That's it. Wow. A little tight over here, huh? You gotta use these things more. And then bend. Good. 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 All right. Bottom half is done.
It's just like a almost sensation around the whole thing. It's just like if I bend it a certain way, I feel it. If I bend it like that, I can feel it like more on the top.
Any of this hurt when I do this? I'm going through each carpal here. So hurts when I do this.
No, not when you're holding it.
How about when I do this? This.
It's literally so odd.
When did this start?
Today.
feels all right. Maybe you just sprained it a little bit or slept on it. You know, maybe like this or like that.
I literally sleep like crazy. But ooh, that's the sore spot.
Yeah, and it's just so. Now, most people have a sore spot right here. That's just okay. I'm sorry, but that's a great trigger point if you don't like somebody, just press them right there, okay? Because everybody has that right here. So I'm sorry, that's normal. But what's not normal is to be so sore over here, outside of it, right there, like a little petechiae there, a little congestion. Yeah, so that's like a taekwondo. Well, I guess it's any kind of martial arts.
Physical.
Yeah, we'll go. Yeah, but this is on the outside of it there.
Yeah.
Too much? This is too much. I mean, and so what will happen is that very oftentimes when there's a joint with not a lot of muscle on it, same thing with the knee, you kind of look either proximal or distal away from the joint.
The actual spot.
Yes, because all of these tendons and muscles influence that. Okay, good. So she's looking to move out to Colorado.
I like animals. I was thinking like wildlife.
Well, there's a lot of that up there. Yeah. Here you just got alligators. I don't know. I don't think it's like that, and we got to search for pythons.
Yeah.
Oh, they're always saying that people release their pets into the Everglades, and that it's ruining the
actual environment.
Yes. The ecology of it. I'm not sure anybody can tell, but this is what definitely is what she has. From about T4 down to T12, her spinal curves to the left here, and you can. I've corrected her on the table, but when she first went face down, this side was just really more prominent like that. And she has a lateral shift to the left here, and this side is higher than this side. This is a classic presentation of a lateral curvature.
And I think it's in a certain percentage of people.
It's in a lot of percentage, especially in that people that come in here. Most people will have it, and they don't have the rotational component of it, and the lateral deviation. Yours is just more prominent. It's okay. Like I said earlier, it doesn't really start to affect you unless you were to get pregnant, and that's when the rib cage really expands and flattens, and then all of this region just gets traumatized, you know, because a baby's occupying this space. And that's when most women complain about that. If anything's too painful or if anything gets too intense, you let me know, okay?
Okay.
You don't have to suffer in silence. There's no reason to. Again, I make a judgment call, but something's like, whoa, okay, I've had enough. Let me know.
Okay. It just is a different feeling.
Well, you've never had a massage either?
Mm-mm.
I think you're doing very good, okay?
Thank you.
Yeah, because most people are whacking me by this time. Oh, God. Oh, God. Then I get, when you're standing there, I saw this shoulder. And you're saying this is a good day.
Yeah.
Yeah, you can see the resistance as Can you see that right here? Right here, watch.
Slip off.
It jumps. And then this side kind of sinks in. So I'm going to push this down, try to correct that. Sometimes I can contract the muscle and get it to if I can get this to squeeze, I can pull the spine over.
That's insane. But in a good way.
Well, your muscles are attached to everything. Yeah.
I don't even know how to explain it. Anxiety just works such a certain way. And if it's so hard to explain to people that don't get it, that don't have it, because the way you explain it literally can make you sound crazy sometimes.
Yeah.
So.
Well, I think I can understand that. I mean, I've had like going through school and opening up a practice. You know, being on YouTube is, in the beginning, I had a little bit of anxiety.
Yeah.
You just get over it.
Yeah.
But I don't think what you're talking about is something that. Do you have like a counselor or somebody that you?
No.
Well, I mean,
I'm so I don't know. Like, I guess the medical practice here, from what I've noticed, because I've been born and raised here, I've literally bounced around from doctor to doctor because I feel like I'm telling them things and they're just, like, not listening to me. Or, like, they're just like, well, you don't know what you're talking about, so you're fine. So it's, like, hard for me to want to pay money.
Right. For
someone to tell me that I don't know what I'm talking about.
Well, there are good therapists out there. Well, then also with a therapist, you have to feel like you trust them at the same time.
Right.
And so I kind of get it, what you're talking about.
Yeah.
They have any, like, online stuff?
Well, I've heard of BetterHelp, but they went through this really, like, crazy, like, I guess, almost scandal type situation.
Oh, no.
Where people were saying that they had hired, like,
sham?
Like, people that weren't actually therapists and stuff like that.
Right.
But I don't personally know.
That was your shoulder?
Yeah. I don't personally know anyone that has used it. I've heard things from influencers on YouTube, but, like, you never know because...
Isn't that who Shane Dawson recommends? BetterHelp?
He got sponsored.
Yeah, that's what I was about to say is, like, most of the influencers that talk about BetterHelp are being sponsored by them. So,
Right.
It's so hard to trust people these days, sometimes.
There are good therapists out there, and after we stop filming, I'll give you the name of somebody.
I mean, I tried a therapist, but I felt like I was going in there to just talk. Like, I wasn't getting any kind of feedback.
Wow.
And I'm like, I can literally do this with myself. Anybody in my life. Like, I literally went in there, and one of the things I said was, like, I would like to learn new ways to cope with situations.
There you go, yeah. But no feedback.
Yes, exactly. Nothing.
Oh.
And I was just like, okay, well, that was a nice 3 or 4 sessions of $100+ that
didn't help me
at all. So it's hard to, like, because it does cost so much.
It does.
It's like nerve-wracking to put that much money into something that you don't know, like, what you're getting yourself into.
Right.
But
we have some training as chiropractors. You know, they train us in psychology, but it's nothing like a therapist would be. But they, you know, we have like a psychiatry course. I don't know if it's called psychiatry. Counseling is probably more of what it is. Course. But that's more of like people's pain, giving them, causing them depression, and learning, mostly learning how to recognize signs and symptoms of certain disorders. But it's bare minimum compared to what a counselor has.
Right.
But, you know, we kind of become these little mini counselors in here talking to people because, and chiropractors, believe it or not, we are one of the few professions that spends the most time with our patients. Just take short sips of air, short little breaths. There we go. Wiggle, wiggle, wiggle. Using my steering wheel move. Here we go. Breathe. You got it. Wow, you're really tough. I'm a bigger baby than you are. I don't know how you guys do it. I'm terrible. I'm like, the whole time.
Just making all the grunts.
Yes, and you guys are so like. Here we go again. You internalize things, and people don't realize that on this YouTube. There's a lot of people that keep it in, and then there's other people like myself
Right.
that scream. Come on, come on. How much more can you take?
I'm doing okay.
Okay. I haven't even cracked it yet.
Yeah, I know. I haven't fallen asleep though, so.
Oh. With work like this, I don't think you can. You just grip on and hold on for dear life. It should feel necessary, though. It should feel like I'm working through it.
Yeah.
And it should get easier and easier every pass. Okay, back down to my elbow. Here's the top part of it. Yeah, there we go. Much better. Like, why do you use a paper towel when you adjust? I don't understand. Like, because she's covered in baby oil. And I'll do a face plant on the floor.
That would not be good.
No. All right, here we go. All the way up. Oh, look at that. Nice.
You need to have a camera facing up into people's faces. Like a GoPro.
Yeah, we had one guy, the skunk crew, Dylan, and he had it underneath. And his face was...
You just need to get some IKEA lights and just put them right in here.
Like something to look at, like a little mirage or something in there. All right, deep breath in. All the way out. Perfect. And again. Second set. And there they are. Very good. And deep breath in. All the way out. Good. Oh, there's like one little one. Okay, I got it all. Okay, good. Now, you're not really a bruiser. I could kind of tell. You just don't have a lot of that superficial scar tissue.
Oh, okay.
So there's nothing really to go over. Now here's your ribs, but other side, no, there's just really nothing there.
Is that good that I don't have scar tissue?
Yeah, that's a good thing. All good things.
Cool.
Like Olaf. All good things. All good things. Sorry, I have kids. And this is the side that I usually use, or this side. And I just kind of take that. And I got this because one of my subscribers mentioned it, another video, which I forgot the name of, and he called it the Little Red Devil.
I actually just watched the plastic jade and metal one. I think you did it on her.
Yes.
Yeah.
Yes. But this one doesn't bruise. But it's a good...
It helps
meter. Yes, it helps my hand, yes. Because I was saying, I want something... I also got some brass knuckles. If the next time I get a big guy in here, I'll have to lay it on him. Okay, and then chin down for me. But you can do this yourself. You can reach behind and do this.
Oh, okay.
Yeah, right here. All right, I'm going to flip the hair to the other side, and then we're going to go head down for me. Right in here. I can feel it. How does this feel? Kind of weird?
Yeah, I mean, it really feels like a bent finger just, like, rolling.
Yeah, I don't know what's different. I still can't do this, though. Here's my thumb. This is why I'm still probably going to use my thumb. I like to grab that like that and pinch it and then do that. I feel like I would hurt you if I did that with this. I can't quite feel it as well.
Right.
And the progress that I'm making.
Right.
It's a good start. It's a good start. Right there. Right there. Oof. Okay. Okay, very good. Very good. You're doing great. I mean, for your first timer, you're doing great. Your sacrum is popped out here.
Is that weird?
You're not pregnant right now.
No. I better not be. I took pregnancy tests and it said no.
you go. This is the SI joint right here, where your pelvis, where the sacrum meets the ilium. This is an actual joint, and I can move this.
Okay.
So this is what I'm going to crack in a little bit. And so I'm trying to loosen up that joint to make it, here we go again, is the least painful or jarring experience for you.
Gotcha.
I need you to tell me if anything hurts.
Okay.
Like, I'm going to take it one step at a time. No surprises here. And back. Your head can go back as long as there's no strain on your back. Anything hurt in the low back?
Mm-mm.
Oh.
Already popped.
Yep.
It's been waiting for it.
Okay, that's all I'm going to take it. Other side. Like, back. There you go. Anything sore?
Mm-mm.
There's one. Breathe. Ooh. Let it go. Nope, that's it. It's just gonna give me that one pop. All right, then that's enough. And then the jaw, I'm gonna have, that's a whole nother thing too. The jaw, if you never stop clenching, it can't heal.
My dentist literally gives me
a bite guard.
I have to sleep with it in because I have like really vivid dreams and stuff. So I like clench and grind, and like whenever I'm focusing on something, I'll start getting headaches because I'm clenching so hard.
Right here. You
Oh.
can really feel that.
Yeah.
You can feel a release when I do that. Right in here. This muscle, when you clench, goes all the way up into here.
Which brings the headaches on.
Yeah, there you go. So you got to release these. It's the temporalis muscle. It's this huge muscle. So you come in here, release that.
Yeah. Is that why people rub their temples when they have headaches?
It's part of it. There's different causes of headaches. This is one type of headache. Let me get a good grip on it. Then lean away from me. There's that.
Yeah, it's like a little crack. Mm.
And they'll get warm and like when you get a piercing.
Yeah.
Lean away from me. More. Good. That's it.
Yeah, it literally just sounds like
crunchies.
like little, yeah.
Little crinkles.
Yeah.
It's like a little hammock. So the TMJ is here. I'm coming right into the corner. And this is what hurts when I do this. But 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Not that bad on this side, huh?
Yeah. Whenever you first started doing it, there was a tiny pop.
Okay. But then after that it got better?
Mm-hmm.
Okay. And then we'll go over here. This side's more beefy. There's more meat over on this side. 1, 2. There's the jaw. There's a joint. 3, 4, 5, 6, 7. I'm gonna go way up. It's all the way out at 9, 10. There you go. That's it. If your eye waters, that's normal. Usually it's on the side that I'm working on. Because what's happening is it's grinding away, and the only thing you can do is just keep it loose and not clench.
Okay.
But even with a mouth guard or a night guard,
Oh yeah, I know. I
you
will
bite right
literally.
through it,
Yeah.
and you're still hurting the TMJ. You're saving your teeth, but you're still hurting this.
Right. Because of the clenching.
So first of all, those moves that we just did are just to open the jaw up. Because some people, they clench so hard it goes into a trismus, and you can't
Yeah, lockjaw.
Yeah, they can't open it up. But that popping sound, really, you've got to get the atlas rocked back down to the skull like that, and that takes the pressure off of the jaw. Kind of like your jaw can kind of relax like that.
Yeah.
Okay, and then it can track better. Cool. All right. What else could we do?
Anything else?
Anything else? I think that's it. I'm going to go over the exercises with you.
Okay.
So, like...
Bye, guys.